Hey, thank you so much for joining. For those of you that are on here right on time, and as well for those of you that joined a little bit early, we're going to give everybody just a second to get set up and rolled into the session here. Uh, the webinar that we're going to be doing today is our most popular webinar every year. We're going to be going through all of the different breaches, all of the different fines, and I shouldn't actually say all. We're really just kind of taking samplings of a lot of the different things that have happened throughout the year and some statistics, some data, so that you all have kind of clear insights into going forward into this year, what you should be aware of, what are people actually getting fined for, what are the primary issues that are facing the healthcare industry today, so that you can bring that back and apply it to your own practices and organizations. One of the first things that we're going to do here is we're going to start by issuing a poll out to everybody. Before I do that, I wanted to go over just a couple of quick housekeeping items so that everybody here is on the same page. Number one, this is actually a new webinar platform that we're using. So if you've done webinars with us before, you're probably noticing it looks a little bit different. All of the same functionality that you had previously for sending questions, it still exists within this platform. And so I would really encourage all of our attendees, if you have a question during the webinar today, please go ahead and submit it in that Q&A box in the webinar itself. So you'll see that on the right of your screen. You'll also see that pinned at the top of that Q&A tab is a free resource that you can click on to get access to, which is kind of like a condensed white paper with a lot of the stuff and the data that we're going to be going through today. So if you would like to get access to that, you can click that link. But also, we will be sending out copies of the slides when the webinar is over. We always get a bunch of questions from people asking, and I'm sure we still will from people that come in a little bit late. Just so you all know, if you want to get access to the slides, we usually send those out maybe a day later, okay? The other thing that I'll say is if you enjoy the webinar today and you're interested in getting additional free resources from us, you can actually go ahead and go to compliancygroup.com. We have an entire library of free resources that you can get access to, including things like basic HIPAA checklists, white papers, ebooks. We have a blog that we post articles to every single week. You'll have a ton of free content on there. And so we just encourage you to engage with that if you think that the webinar today is helpful. And we would love to keep helping you out as much as we can. All right. Now, one of I'm going to send through a quick poll here, and let me stop sharing my screen so that I could publish this poll to everybody. You're going to see this pop up on your screen now. And the question is just simply, do you believe you have an effective compliance program in place to avoid HIPAA fines? Hopefully, and again, don't worry, nobody's going to be coming after you. You can answer this anonymously. I think that for us, it's just a good idea to get an understanding of your level of confidence. If you're sitting in on this session today, how confident are you that you're actually doing all of the things that you need to be doing? Because for those of you that are really confident, we might want to go over some more advanced things and talk a little bit deeper. For those of you that are not that familiar, at the beginning of the webinar, we will be going through some educational content just to make sure that everybody that's on here feels comfortable, that we're all on the same page, and just kind of come into true north a little bit as far as what HIPAA actually requires of you. So I'm going to be closing this poll. All right, very interesting. So we had roughly 65% of you say yes, 35% no. It's great to see that the majority of you are feeling good and confident in your compliance program that you have in place right now. For those of you that are not feeling confident, one of the things that I don't want you to get out of today is to feel like by going through fines and breaches and things that happened last year, this is not meant to be a scare tactic-y sort of a webinar, okay? Our goal legitimately is we would just want to take from some of those previous things that we've seen happen in prior years and use that to give you really, really practical insights and guidance on how you can now bring this back to your organizations and begin working on your compliance program in ways that are very simple and very effective. So the goal here is to keep this as practical as possible. Again, if you have any questions at all as we go through, go ahead and ask. I'm going to go ahead and jump into the content here now. but feel free to send through a chat or a Q&A if you need anything as we go through. Okay, so without further ado, I'll give you just a very little bit of background on Compliancy Group. Compliancy Group has been around for about 20 years. We service roughly 6,500 organizations, ranging from very small practices to larger organizations and health centers with thousands of employees. In the history of our company, we have never had one of our clients fail any type of a HIPAA audit investigation or be fined. And that's not a sales pitch. That's legitimately just to say that the things that we have implemented, the techniques that we have followed with our clients over the last 20 years have been proven to work. And our goal for today is to hopefully share some of that wisdom so that you can leverage this within your own companies, however you choose to. Okay. At the end of the day, we want to simplify compliance so you're able to confidently grow your business and focus on what you want to focus on. Like I mentioned previously, I'm going to give a quick introduction here, just go through some compliance basics. For those of you that are very familiar, this might be a little bit redundant. I promise I'm not going to spend a ton of time here. But for those that maybe don't know much, I always like to start by giving a little bit of background because it can be some helpful data. And so the first thing that I always go through is the 7 fundamental elements of an effective compliance program. All of healthcare compliance is ultimately regulated by Health and Human Services, as well as the Office of Inspector General, under these what they outline as these core 7 fundamental elements. It is basically like their boilerplate requirement for what you need in order to say that you are compliant and that you have a compliance program in place. Okay. I'm not actually going to talk through each of these things right now this second. We'll go through a little bit of a workflow that we recommend following momentarily. The thing that I really want to highlight here before we go any further is actually just that word effective. Okay. It's an effective compliance program because when you look at the majority of these regulations, and let's say HIPAA particularly as an example, the HIPAA regulations are written in a way that is almost intentionally vague because it has to apply to, let's say, what might be a very small solo provider practice, all the way up to the largest regional hospital systems and health plans in the country. Okay, the law does not change at all whatsoever, regardless of how big or how small or the uniqueness of your business. It is the same rules and regs that apply to everybody. But the requirements are published in a way that, again, is very broad, somewhat vague, because they don't want this to be a check off of a box, right? They want you to understand these guidelines and implement them into your organization or practice or business in a way that is effective for you. Because what's effective for you might be overkill for somebody else. What's effective for you could be woefully inadequate for another practice as well. And so the general workflow that we recommend following here, and there's lots of different ways that you can get on the OCR's radar. Sorry, I think I must have skipped this slide. The general workflow that we recommend following is, number one, you'll see this come up in a lot of the fines that we're looking at. This is what I call the life cycle of compliance. Okay. Completing risk assessment, identifying gaps, creating remediation plans, and then implementing policies and procedures. That's kind of like the foundation, right? That's what you need to do first. 70% of all of the HIPAA fines that have ever been levied historically referenced missing risk assessment documentation as a key reason for the fine. So if you're on this webinar today and you know very little about compliance, you're just kind of getting your feet wet, you're getting familiar, you might be new to this, the very first thing that you need to figure out how you're going to be, the very first thing you need to figure out how you're going to do this year is figure out how you're going to complete or HIPAA risk assessment. That is what the Health and Human Services defines as the foundation of your compliance program. It is what informs you into what actually you need and what's going to be effective for you. And it's how you're able to then document your progress year over year in a way that allows you to avoid a HIPAA fine. Because the equivalent, unfortunately, of what many organizations and small practices particularly, their compliance program is the equivalent of a binder that sits in the back of somebody's office and collects an inch of dust over 5 years. That is not seen as effective in the eyes of the government because there's no way of you proving month to month, quarter to quarter, year to year, all of the different things that you might be doing for your compliance. And if you're not able to do that, you're going to be in trouble if there's ever an issue. Okay. So completing a risk assessment, making sure that for any gaps that are found in that assessment, that you have clearly documented remediation plans. Usually once that is in place, you'll know then what policies, procedures, and documentation you need. You'll know what you should be implementing as far as employee trainings, making sure as well that they're signing off on your policies. As part of that assessment, you'll usually do a review of your vendors, making sure that you have all of the right business associate agreement in place. You'll implement incident management protocols as part of those policies, and then we'll be able to tackle confidently any types of HIPAA incidents that occur. And then guess what? You do that again every year, right? And if it's not being done every year to the government, it's not considered effective. The risk assessment, both under HIPAA as well as MIPS, is something that needs to be done annually or on an ongoing basis, is the term that the government uses. Okay. And once you get into this cycle, though, you will do this one time, and every year it gets easier and easier because hopefully in year one, you address all of the issues that you found. And then it's just a matter of upkeep, right? Each year, if you identify new gaps, you remediate them and you resolve those things, and then everything is being documented. That is the life cycle of a compliance program. And so I always start here. Again, if all of this stuff just sounds super confusing and overwhelming, focus on your risk assessment. There are free tools available through the government. That is also a service that we provide through our software. If you'd like to learn more, I'll talk a little bit more about that at the end, but that should be the first thing that you're figuring out how to do. Now, a couple of things as far as how you actually get on the OCR's radar. There are a lot of different ways that you can actually be audited as a result, let's say for HIPAA specifically and by the OCR. I will say, just to give some clarification, Health and Human Services writes the regulations. It is the OCR that enforces them, right? So if you were ever being audited for a HIPAA issue, that'll come directly from the OCR. It is not going to be via a phone call. There's a lot of scammers out there sending postcards and calling practices. You'll get a written formal letter of notification from the OCR asking you questions, essentially. A couple of different ways that you can get on the OCR's radar. It could be because a vendor had a breach. It could be they're just auditing you randomly, which is less common if you're a very small practice. Meaningful use failure or macro MIPS issues if you're billing Medicare within your practice. These two here at the bottom, reported whistleblower complaints and breach notification issues, are the two number one ways that most organizations get audited. Okay. It's either a patient or an employee files a complaint against you with Health and Human Services, or you have a breach that needs to be reported and the OCR is following up to investigate what took place and make sure that you have everything in place from a compliance perspective. Okay. That's how you get on the radar. Let's talk about ways that you actually can get in trouble. And this is where we're going to start unpacking the actual fines that were levied from the past year. Again, if anything that I just talked about was not clear, go ahead and ask that question in the Q&A box. I am seeing that we have a question here, so I'll just address this very, very quickly. Okay. Is this webinar being recorded? If so, besides the slides, will we get a copy of the recording? Yes. All of our webinars are recorded. When you get the copy of the slides, you should be sent a copy of the recording as well. It will as well be posted on the Compliance Group YouTube channel if you'd like to get access to it once again. Okay. So breaches and fines from 2023. You're going to see that there are some very common threads through some of these that we'll be picking out. Risk assessment, also known as risk analysis, is a very common, very common issue for most organizations. Like I said, 70% of all of the HIPAA fines that have ever been levied were due to missing risk assessment documentation. And you can see in this case, both of the organizations actually had multiple incidents and investigations ranging from 2014 all the way through to today. Okay. LA Healthcare Plan, multiple violations. Essentially, there was a reported breach compromising over 1,500 people that happened in 2019, as well as 2016. Along with 2014, there was an online portal where patient information was being published. Lots of issues here, but essentially the government fined them because in their audit, they determined that they had not completed their risk analysis and they had not implemented any type of remediation plan that would have addressed these sorts of issues, even in the assessments that they did. And this highlights a really important thing, right? You could see this one here at the bottom. It's a very similar situation. It was a huge breach, a hacking incident, but the fine was not because they were breached. The fine was because they couldn't prove that they had done a risk analysis and implemented the necessary remediation plans. And I'm bringing this up because a lot of people think, well, how could I ever actually be bulletproof? Right? How can I make sure that I'm never fined? And really, the way that you make yourself bulletproof from a compliance perspective, you can't prevent anything from ever happening. Breaches happen, mistakes occur. What matters is that you have documentation to support yourself in the event that the government is auditing, right? So in this case, it wasn't the breach, it was missing risk assessment. You'll see other fines that were levied, not because an employee made a mistake, but because they couldn't prove that they trained that employee. You'll see breaches from vendors. They don't get fined because the vendor had a breach. They get fined because they did not have a business associate agreement with that vendor. And so that life cycle of compliance that we went through before, that wheel, that's what you need to be thinking of. Having clear documentation for all of those things is how you actually mitigate your risk of a fine. Mistakes happen, right? The US government itself has breaches, gets hacked, makes mistakes. What matters is your ability to prove and show clear documentation for everything. And I like to make that really clear before we go through anything else, because you can get really spun up, but as long as you have clear documentation of all of these things, you'll be okay. Okay. Now, a couple of other fines to look at. I'm not even sure how to pronounce this first one, but I'll give it my best shot. Laforge Medical Group. 34,000 patients' PHI was accessed by a phishing incident in 2021. For those of you that don't know what a phishing attack is, this is essentially, let's say that one of your employees gets an email and the email looks like it came from somebody in senior leadership. It tells them to click this link. Please purchase credit cards for the team. Please purchase gift cards for the team. Or please log into this system using your EMR credentials and so that I can set you up with something. It is a deceptive way of getting one of your employees essentially to give somebody else access to your system. And usually the result of a phishing scam is that you get something called ransomware, meaning they'll get access to your database, they'll encrypt all of your data, and then you need to pay a lot of money to get access to it. This is a huge way that patients get their information breached every year. In this particular case, the main issue was that they did not have policies and procedures and training that their staff were attesting to concerning things like cybersecurity and security requirements concerning email. That's something that everybody should be training their employees on. It is a requirement of HIPAA, so that's something to really consider as you're going through your own reviews this year, is to make sure that you have policies that satisfy all of those sorts of requirements specifically, okay? Yakima Valley Memorial, $240,000 fine, and this was due to what's called the minimum necessary standard being violated. 23 security guards were essentially using their credentials to access patients' PHI. They were essentially snooping around into other people's information. And it was the organization that got fined for this because they were not complying with something called the minimum necessary standard, which is one of the HIPAA requirements, okay? Essentially, what the minimum necessary standard states is that if you have an employee that does not need access to your patient's information to do their job, they should not have access to it, okay? That alone, that violation and them not having a policy concerning those things is what ultimately led to them being fined. Okay, so be aware of the minimum necessary standard. In most small practice environments, of course, your employees are going to be engaging with your patients, so they need to have access. But the larger the organization gets, the more chance there is that you probably have a lot of workforce that do not need access to patient data or should not have access to it. And so we want to make sure that that's clear. Okay. Optum Medical Care of New Jersey. This is a right of access violation, A practice was fined $160,000, essentially because a patient filed a complaint against them, stating that they were requesting copies of their records and the practice was not supplying them. This is a huge enforcement initiative of the OCR. It is enforcing the right of access requirements or the right of access rule under HIPAA. There are lots of other new regulations like the 21st Century Cures Act that overlap with this. But essentially, if your patients are requesting copies of their medical records, by law, you have to provide them. Okay. You can't withhold those records, even if they have overdue balances or they're not paying their invoices. You are required by law to provide them with their information if they're requesting it. And a great way to avoid these sorts of issues is by maintaining a clear log of patients that request information, come up with a formalized process for responding to those inquiries, and make it really easy for them to get access. Okay. I'm just looking through the chat here. I see. I have a couple people saying that they're having trouble hearing me. Hopefully, nobody else is having that issue. Um, Let me just go through the chat here. And folks, again, circle back and we'll make sure that we go through all of these questions at the end. Seeing a lot of questions coming in, and I'm not going to be able to get to everything as we go through. We will be circling back at the end, and I'll go through these one by one and make sure that everybody's questions get answered. If you have a question, though, please send it in the Q&A section, not in the chat section. Okay, the chat section you can use if there's things that you just want to make mention of that you want us to be aware of. The Q&A feature is where I'll see your questions and we'll be able to answer them as we go through. Okay, so a couple more fines here. MedEvolve, $350,000 fine. The OCR essentially in their investigation uncovered that there was no security risk assessment completed. And they also did not have a business associate agreement in place with a subcontractor that ultimately led to the fine. Okay. And this was a pretty severe network server incident that affected roughly 230,000 patients. Oddly enough, network server related incidents is the most common location of breached health information in the country. Okay, this comes directly from the HIPAA Journal out of 2023. I'll make mention that the one very interesting statistic is that a single healthcare record can be sold anywhere between 5 and 10 times more on the black market as compared to a debit or credit card number. Because healthcare information, particularly if it includes things like dates of birth, socials, insurance information, that data can be used for identity theft, blackmail, and any number of other things. So it's valuable information that you have access to, needs to be protected, right? iHealthcare Solutions, these were both business associates, by the way. They had a breach reported indicating that there was an unauthorized transfer of PHI from an unsecured server, so another server issue. And in the OCR's investigation, it was ultimately found that they had also not completed a security risk assessment as required under the HIPAA rules. So another two areas where a risk assessment probably would have addressed these sorts of issues and non-compliance and protected these two organizations. Couple more we're going to go through, and then we're going to get into some lessons and practical takeaways, but hopefully even this has been helpful so far. You'll see that these two here on the left, right of access failures, Manasseh Health Center, as well as United Healthcare, these were both just straight up right of access failures. Patients were requesting copies of their information. These organizations were not replying, were not supplying copies of these records. And by the way, these sorts of fines, these are slightly larger organizations that they were levied to. There's a small solo practice not too far from where I live as well that was levied a $100,000 fine, not only because of a right of access issue, but because he was being completely unresponsive to the OCR's investigation requests. So key takeaway here, if patients are requesting their records, you should always give them access to it. Second thing is if the OCR is auditing you, always be extremely cooperative and responsive with their requests, okay? They're usually pretty lenient to people that are responsive and are getting back to them. as compared to the ones that are ignoring those inquiries. Okay. St. Joseph's Medical Center was an interesting one because it was during the COVID-19 pandemic. There was a news outlet that was given access to the medical center, and they were taking photos and videos and posting them online. And this included patient information. Some of those patients reported this issue to the OCR, and essentially what the OCR found is that they had not had the proper policies, procedures, and employee trainings in place that hopefully would have prevented this from happening in the first place. Okay, so $80,000 fine. Another a good example, you should not be sharing or disclosing patients' information on your website, in media, even in the way that you reply to online reviews without their express permission. Even if patients are giving you testimonials, you need to have written authorization to use those testimonials in your website or in any of those environments. Super important. Okay. Now, couple things we'll go through here. What caused the majority of the breaches in 2023? Hacking and IT incidents were reported more than any other breach, and this is most common in the healthcare space. So healthcare, even outside of financial and every other industry, financial, education, doesn't matter what it is, 65% of all reported breaches in 2023 were healthcare organizations affecting more than 36 million patients. Okay. Uh, Healthcare is a big target because of how valuable the information is, like I was just saying. Okay, so cyber predators also are specifically targeting healthcare because where, let's say, it might be difficult for me to get access to data in a large health center, or let's say even in the financial space, there's a lot of big banks, Chase Bank, TD Bank. In the healthcare space, there's a lot of small organizations, a lot of nonprofits, a lot of private practices, a lot of companies that are not big enterprise conglomerates that maybe don't have advanced security infrastructure in place. Now, when you hear things like hacking and IT incidents, it's really easy to think that you need that means you need all of this advanced technology or uh, technical expertise within your practice, but really the number one way that you prevent even hacking and IT incidences from happening is by having really good policies, procedures, and training. Because even in the event of an IT incident, over 76% of the breaches that happen that are IT related are as a result of human error. Okay. And so that makes it continue to be one of the greatest threats that we see within the healthcare space because while organizations, let's say, could be focusing on advanced technical security, you have a great EMR, there's all of these things, that doesn't necessarily mean much if your employees are making silly mistakes and errors. So investing into a good quality training for your employees, making sure that your employees are reading and agreeing to your policies on an annual basis is one of the best ways that you can mitigate your risk of a hacking or IT incident. It's like 90% of people that had ransomware attacks had antivirus and anti-malware software installed. Only about 13% had employee cyber security training. Okay? So it's a great way to mitigate your risk just by doing policies and procedures and training. Right. And in the past 4 years alone, there's been a 239% increase in large breaches reported, 278% increase in ransomware. Uh, Hacking accounts for 84% of the breaches reported to the OCR, millions and millions of patients. It keeps going up year over year. This is not an issue that's really getting better, unfortunately. Hopefully, in years to come, there's ways that we can more thoroughly lock this down. But for now, my recommendation, like I said, for everybody, the best thing that you could do is complete that risk assessment requirement for HIPAA. Identify if you have any significant technical needs from an IT perspective, but that'll also help you identify what your needs might be as far as policies, procedures, and training are concerned. Right? Let's go through a couple of lessons. And hopefully everybody here is still with me. Again, we'll be circling back very shortly, going through the questions that we received. If this has been helpful so far, give us a 1 in the chat so that we know we're doing a good job thus far. All right. Couple things to go through as far as lessons from breaches and fines. Right. Number one is that compliance programs are a need, right? This is not some sort of like an optional thing. Okay. The seven fundamental elements of an effective compliance program are required, whether it's HIPAA, OSHA, fraud, waste, and abuse, OIG, doesn't matter what it is. You need an effective compliance program. And part of why we're saying that this is a need is because, again, if you look at all of these breaches, fines, and issues that have taken place, the only way that somebody gets fined is if they're missing some component of an effective compliance program. It's not about just making sure that you're bulletproof and that you never have a breach. It's about making sure that you have proof that you're doing all of these things. Really, truly can't emphasize that enough. And when we're talking to people, and even as you're going through the risk assessment requirement of HIPAA, don't think about that assessment in terms of what am I doing right now? Think about it in terms of what would I be able to prove if I was being audited? And you'll find that that makes a big difference in how you approach that assessment process, how you look at your environment, and hopefully help you identify some potential deficiencies that'll help protect you in the long run. Because if you do that right one time, it's much easier to then maintain it into the years going forward if you actually have addressed all of those gaps. Okay. Another key thing is that hacking/IT issues continue to be the number one issue that we see healthcare organizations facing. This is not going to change. Security and compliance go hand in hand, right? So the number one way that you can mitigate your risk of things like a ransomware attack is by having a really strong backup, right? So for those of you that are in here today, if you were a victim of a ransomware attack and you lost all of your patient's information, how much time would it take you to get back up to speed? Okay. Do you have a backup in place that you could load up very quickly if something like that was to happen? Because then, even if you had some type of a major IT incident, you might have to report that as a breach, but you'd be able to get back up and running very quickly. That's something that we see a lot of practices in smaller organizations don't have in place. So think about your backups, think about how you're training your staff, what policies you have in place. All of that stuff is super important, right? Next thing is right of access. And I think that for our audience, the right of access initiative is probably one of the most important things that we can highlight on this webinar. 65% of all of the fines that were levied last year and the year before were two very small private practices, even solo practitioners. And it's because of the right of access initiative. This is one of the number one ways that you can get on the OCR's radar right now is that if a patient files a complaint against you for a right of access issue, this is a straight up black and white sort of a thing. If the government finds that you did not respond to those inquiries in a timely manner, they're going to fine you. It's a little bit different from some of the other types of enforcement initiatives that we see from the OCR. So take this seriously, keep a log, treat it like a customer service request, and make sure that you have a clearly defined policy that your employees are attesting to for a right of access. Right. And then lastly, you can take a look at some of these things. And again, you'll be getting the slides when we're done. But in terms of the most frequent complaints that are, let's say, filed with Health and Human Services due to compliance-related issues, impermissible use and disclosures is the number one, meaning a patient is complaining about you because you disclosed their PHI to somebody that you weren't supposed to. One way that that happens, which is very, very common, is actually through online reviews. If a patient leaves let's say they leave a negative Google review or a negative Yelp review or on ZocDoc or whatever platform that you're using, you need to be so careful in how you respond to those reviews. There was a case that happened, I believe it was about 2 years ago now, small dental practice. They had somebody that left a negative Yelp review, and the employee that was responsible for their social media essentially replied to that review, confirmed that patient's insurance information, gave a whole breakdown of the scenario in this review. In their reply to the review, the patient who they left a negative review as it is, right? They're probably already upset. You're giving them more of a reason to be upset. Now they go in and they report you to the OCR. The OCR investigates. If you don't have a strong social media policy and you can't prove that that employee attested to it, you're going to get in trouble, right? Uh, it should always be, and I see Nancy, you said canned response, very basic. That is exactly right. You want to say, don't even use their name. Just reply, say, thank you so much for leaving this review. We appreciate your feedback. If you would like, please contact our office to address any issues at this email. Same thing even with positive reviews. There was actually a behavioral health practice that received an amazing testimonial from one of their patients. Very lengthy, very beautiful handwritten testimonial. They posted a picture of it on their website. The patient, they received great treatment at the practice, but they didn't want their information being disclosed online. They complained about it. That practice got fined. You got to be really careful. Make sure that you always have the right use and disclosure documentation in place. You can review all of these other things as well. Minimum necessary, patient access, right of access. There's a lot of stuff here. Okay, a couple of predictions. Privacy rule, right of access. This is going to continue to be a big thing. We talked about it a bunch already, so I won't spend too much time here. If you don't have a right of access policy, if you don't have some sort of a log where you're maintaining this, get that done. All right. 42 CFR Part 2. Okay, so this is not going to apply to everybody on this meeting, but for those of you that are, let's say, Part 2 participators, or if you are a substance use facility that is federally funded, there's some interesting changes that are coming that are potentially merging the privacy rule and 42 CFR Part 2 so that all of this stuff is kind of integrated under the umbrella of HIPAA. Our belief is that it's a very distinct possibility that that will happen in 2024. It might sound intimidating because you might have to change some policies. The benefit, though, is that you'll have fewer regulations that you need to comply with because it's all going to be bundled under the HIPAA requirements. Okay. And this is a big one here. For those of you that are doing any type of online marketing, if you're using a marketing agency, let's say in particular, there's something called the Metapixel, as well as platforms like Google Analytics that essentially allow you to retarget visits to your website with ads. So if you're doing online advertising, or if you have an agency that is managing this for you, you're going to want to reach out to them and just make sure that they know what they're doing as far as HIPAA compliance is concerned, and that you have a very strong business associate agreement in place with them. There's new guidance from the government that prohibits the use of tracking tools like the Facebook or Metapixel, like Google Analytics. If you're using those tools, they can get you in big trouble. There is a lawsuit right now. The American Hospital Association is actually suing Health and Human Services for this new guidance because it's something that they leverage heavily. But it's going to be something that we can continue to be enforced. I think that the marketing sector has some long overdue regulations that are coming towards it just to protect patient confidentiality. And so be aware of that. If you're doing any type of online marketing, you want to be extra careful and maybe start digging into this. Okay. All right. In the end, there are some also changes coming as far as the cybersecurity space is concerned, where not only will some of the new cybersecurity frameworks that are being published by Health and Human Services, and this is nothing that has been officially put into law yet, but it is proposed that there's a new, essentially, cybersecurity framework that practices can be implemented that would actually incentivize them from an insurance reimbursement perspective, but also help them avoid monetary penalties by adopting kind of a universal set of standards within their organization. This is another thing that we expect to be coming this year, something that is worth following because it's another way that you could just mitigate your risk and make sure that you're adopting a universal set of standards. All right. Without further ado, that's concluding the content of today's webinar, folks. Hopefully all of this was helpful and you got a lot out of it. As I'm going to start going through some Q&As for today, but again, hopefully this was helpful. And before we start going through the Q&A, in the top right corner of your window here in the webinar, you'll see that you have a button that'll take you to a demo scheduling form. Uh, Essentially, what we do here at Compliancy Group is we have a software that's designed to help you automate everything that we've talked about today. You'll be able to complete risk assessment, document remediation, set up policies, distribute trainings, all through a single tool. It's very simple and easy to use. If you click on that button and schedule a demo while we're still live here on the webinar today, we'll actually give you 15% off of the plan. Okay. So whatever the subscription cost is for being on the webinar today and scheduling a demo while we're live, we'll give you a full 15% off. We'd love to chat with you more about that. You can go ahead and inquire just by clicking that button. All right. I'm going to start going through some questions here. We have quite a bit. So folks, I apologize if we're not able to get to everything. We will have somebody reach out to you if we're not able to do it live. Okay. So somebody's asking, do you do consulting outside of the compliance platform? We don't offer traditional consulting. One of the things that we do offer, though, is what we call coaching, where included in all of our subscriptions, you would be paired up essentially with what we call an onboarding coach that'll meet with you and walk you through the setup process. And we can also verify your compliance upon completion when everything is said and done. If that's helpful or relevant to you, we would love to help you out with that. Okay. I'm not sure if this is a question here, but it came through as a question. It says encrypted emails versus not encrypted. So the topic of email security is a really interesting one. The general rule of thumb, and the thing that I'll say first, is that if you are using a free email, it's not compliant. Okay, there's no such thing as a free email that is fully HIPAA compliant. All right. So as far as that stuff is concerned, our recommendation is number one, if you're on a Gmail, upgrade to Google Workspace. It's like $6 a month. If you pay a little bit more, you can actually set it up so that it's fully HIPAA compliant, encrypted, and all of that stuff. The other option that you have is you could do the same thing if you're using an Outlook email. And then you can even purchase, again, a couple of bucks a month, an email encryption service that will encrypt the emails as you're sending it, same thing as it's storing it. So that could be a good thing for some of you to consider if you're emailing patients very consistently and they could be potentially sending you confidential information. Okay. Do you have any information on who would be considered a BA? I.e., would a male person be a BA? Okay, so things like postal workers, UPS, FedEx, they are considered to be a conduit under the HIPAA rules. They have their own regulations that they need to abide by, so you don't need a business associate agreement with those folks. So any of those mail carriers, delivery persons, you should not have any issues as far as that's concerned. What if an organization will only give you a copy of your records if you pay for them? So this varies state by state. Okay. If you have a concern around charging your patients for copies of their records, it is something that we recommend consulting a local regulatory attorney on because the requirements differ state by state. And you can only ever charge a patient for their records, period, if they're requesting them for their own use. Okay. Meaning, if I'm requesting my records so that I can go get treatment from another practice, you cannot charge me for that. Okay. You have to supply those records free of charge. Are you addressing organizations that have HIPAA violations but are not fined? So in this webinar, we particularly went through a bunch of HIPAA fines that were levied because that is what the government publishes. There are many corrective action plans that the government implements, though, that don't include a monetary penalty. Oftentimes, transparently, the fine can be better than a corrective action plan because essentially what the government will do is rather than fining you, they'll say, we're going to monitor you for the next 2 years. You need to supply us with a quarterly report showing proof of all of these things that you're doing. And if you're not keeping up with that, then you get fined. So there's lots of different ways that can happen. Again, the main thing is your ability to prove what you're doing is how you'll mitigate that just in general. Okay. Next question. What legalities exist when an insurance company requests a patient's medical records? So an insurance company, provided that it is for treatment payment operations, TPO, they have every right, of course, to request copies of those records. As long as it's covered entity to covered entity, meaning you and the insurance carrier that you're billing that patient through, is not usually an issue. There might be some stipulations, but that is usually not something that is regulated because it's permissible. It is a permissible use and disclosure under the HIPAA rules. Okay. Is there an OCR or HHS site that houses organizations' fines, penalties, and copies of corrective action plans? Yes. So you can go on healthandhumanservices.com. If you Google HHS enforcement, you'll see their enforcement page, which outlines all of these different case studies. Not everything is public record. The other thing that you can Google is OCR Wall of Shame. They have what's called a breach portal, where any organization that has had a breach of more than 500 patient records, it's publicly posted. They could see it. You'll probably even see people in your local town or city if you go on there and look it up. Okay, so yeah. Can you provide a link to the guidance for web visitor tracking? And this suddenly disappeared on me all of a sudden. Yeah, so let me see if I can find that quickly. I believe, all right, yep. So use of online tracking technologies by HIPAA covered entities and business associates through HHS. I went ahead and just sent that to everybody in the chat. All right. Let's see. And again, folks, I apologize ahead of time. I'm not going to be able to get to all of these questions. Thank you all for submitting these. We will follow up with you if we're not able to get it live. All right. Let's see. How do we ensure BA complying with HIPAA? So if assuming that you're referring to a business associate, the primary way that you mitigate your risk is by first having them sign a business associate agreement. Okay, that's required under the omnibus rule of HIPAA. The other thing that you could do is, and it is an expectation of the omnibus rule, is that you're doing some sort of a due diligence on those vendors, that you have assurances that they're safeguarding that data. If you're working with a larger organization like Microsoft or Google, they have certifications that actually supersede even the requirements of HIPAA. So you're usually okay there. But if you're working with like a smaller vendor and you're not sure, you're not confident about what their security or compliance is and what they're providing you, we always recommend just like documenting, asking them a bunch of questions, even if it's via email. Have them reply to those questions and just confirm that they're satisfying those requirements, that you have that in place, and then store that as part of the business associate agreement. Okay. The other option that you can have is you can even just take snippets of your risk assessment and ask them those same questions to make sure that it's being addressed. For the right of access, do online reviews pertain to this complaint in any way? Right of access is not necessarily about online reviews. That's more of a use and disclosure issue if you're replying to a patient online. Right of access is specifically, I am requesting a copy of my records from you. I have a right to access those records, and you are not providing them to me, right? That is a right of access violation. Okay. When you say risk analysis, are you referring to the security risk assessment? All right, so these are somewhat confusing industry terms. Many of them mean the same thing. So the answer is yes. Under HIPAA, they use the term risk analysis. Under MIPS, they use the term security risk assessment. You'll also see the term security risk analysis, or SRA, also used for security risk assessment. It all means the same thing, provided that it's touching on technical, administrative, and physical safeguard requirements within your environment. Okay. As long as your assessment is covering those needs, meaning it's not just technical, it's also covering administrative requirements for policies, procedures, and training. It's also covering your physical location. That is going to be satisfying the security risk assessment requirement. It should also include a log of your devices and things like that. Okay. So kind of there's a bunch of industry terms. Ultimately, it all means the same thing if you hear those. All right. Another question very similar to that. Hopefully, I answered that live while we were on here. Okay. How do we know what additional policies slash procedures we should have in place above and beyond standard privacy and security? This is something that you would identify in that risk assessment process. Okay. So just make sure that you're going through the most up to date assessment requirements. These are all things that would be covered inside of our program as well. So you could feel free to request information with us. Again, on our demos, folks, it's really like a no obligation call. We'll give you an overview of what we can provide. If you like it, you're welcome to move forward. If not, we hope that you at least have some good education that you can then go and manage this yourself. But usually, even by doing a demo with us, you'll get a good handle on kind of what your needs are, and it can just be a helpful conversation. So, but no pressure either way. Okay, another question about HIPAA risk assessment versus risk analysis. Yes, again, sorry, there's a variety of industry terms. A lot of it means the same thing. Okay. Uh, Another question about risk assessment. Yeah. So, really, all that this is, it has to touch on technical, physical, administrative requirements. You'll have a lot of IT companies that say that they're doing an SRA, but primarily what that's covering is just your IT. It's not touching on your policies, your procedures, your trainings, your documentation. And in order for it to be an accurate and thorough risk analysis, as HIPAA deems it, it has to cover all of those different components. So, we break this down even further. So shouldn't cover privacy policies, security policies, breach notification, should cover your devices and applications, your physical site, and your physical site. There was one more that I'm forgetting. We can get you right up on that. But in the end, all of that's going to cover you. Okay. Oh, there's something called as well. I forget. It's called High Tech Subtitle D, which is essentially just overlapping with the high tech requirements that are under the umbrella of HIPAA. Okay. Do you have templates for creating documentation? We don't provide these on our website, but we do provide a complete library of every single policy, procedure, training, form, document that you could possibly need for your compliance program as part of our service. So again, those are all things that we would have built in for you if you became a client of Compliancy Group. And but again, you can always utilize government resources and do this on your own if you chose to. We're really just a quick and simple way to get this done for the practice pretty affordably if you need to. All right. So let me see. I'm going to be able to go through like two more questions, folks, and then we're going to wrap this up here. Let me just make sure. Can you post a link to your YouTube channel, please? I think we have Amber on the backstage of this webinar. Amber, if you could please post a link in the chat to the YouTube channel, that would be great. Okay. Can you please provide some highlights or key points regarding the CARES Act that could be sent to all practices? So the CARES Act is somewhat complicated, and primarily the main organizations that are going to be regulated under the CARES Act is actually the EHRs and the EMRs, right? Number one, the goal is to promote something called interoperability, meaning it should be easy for patients to get access to their records and it should be easy for them to transfer those records. Okay. The topic of interoperability goes very, very far and broad. It also covers how you transfer data, how they format it in the EMR to make it easy. There's something called SL7 even that deals with all that formatting stuff. So the main thing though, under the CARES Act that those of you on this webinar might pay attention to is more the information blocking component. And information blocking is really just another reference to the right of access requirements, which means if a patient is trying to get access to their records, or if a practice is trying to get access to records through the EMR to transfer them, at no point in time in the process can you prevent either a patient or a practice from getting access to those records. Those are kind of like the bare bones base of the CARES Act. Happy to discuss it more. You can feel free to shoot me an email. My information is here. All right. So, folks, yes, for those of you that were asking, that is my email. That is my direct line. If you are interested in chatting, you can always feel free to shoot me an email. If you have questions or feedback for this webinar, what I would say is you will be getting a survey when you close out the webinar asking for some feedback. We love getting feedback from our attendees because it just helps us make these webinars better and better. So if you enjoyed the webinar or you want to roast me, go ahead. You can fill out that survey. Let us know, or if you have advice or tips and things that you think would be beneficial for us to cover, that'd be super helpful. All in all, folks, we really appreciate you all attending the webinar today. For those of you that we were not able to get our questions answered, go ahead. You can fill out that survey. Let us know. We'll make sure somebody gets back to you. And then otherwise, we're going to wrap this up here. So if anybody, and a question from Jeremy, it is L Degnan at Compliancy Group. So it looks like there's a typo there on the slide. I apologize. So thank you for calling that out, Jeremy. If anybody needs anything, go ahead, contact us. You can request information in the survey as well. We really appreciate all of your time today. Thank you so much.